Hello, my name is Ron Al-Hawari, and I'm the current Scoliosis Research Society Communications Council Chair. And it's my pleasure to be hosting the 100th episode of Scoliosis Dialogues. Now, it doesn't seem like too long ago that Peter Newton, back in 2018, 2019, created a research task force while he was president. Marinus de Kluver, our current SRS president, was head of this research task force, and I was a small part of it, looking at innovative methods of disseminating research and education. And out of that spawned another task force to look at the potential utility of creating a scoliosis podcast series. And we'd started Scoliosis Dialogues in October 2020. And I had the pleasure at that time of co-hosting with current or president at that time, Paul Sponfeller, discussing the 2020 virtual SRS meeting. This was in the height of the COVID pandemic, and it was the first of many, many podcasts that we've had. We initially thought we might publish a podcast once every month, but under the leadership of the first podcast committee chair, Jason Brooks, we've been on pace for about 2 podcast episodes each month, and here we are at number 100. And John Voorhees has been the next chair of the committee, and soon will be Jeff Mullen, and then Grant Hogue in a couple of years. So the future is bright. So we're going to get started with an interview with several of the more recent Scoliosis Research Society presidents, including Steve Glassman, David Pauly, Ken Chung, Todd Albert, Peter Newton, and Serena Hu. And our 100th episode theme will be the biggest changes in the last decade and where you see things going in the next 10 to 15 years. All right, well, let's get started with the first of our guests. Steve Glassman was SRS president back in 2014. Dr. Glassman, why don't you start by telling the audience a little bit about yourself, where you work, and what some of the proudest accomplishments you had as the SRS president at that time.
Yeah, I'm Steve Glassman. I'm at the Leatherman Spine Center in Louisville, Kentucky. I was SRS president about 10 years ago. Boy, it doesn't seem like it could be that long, but I guess the numbers don't lie. I thought some about what I thought the accomplishments of my presidency were. I think one of the things, in retrospect, you sort of get a view of maybe what you accomplished. I don't know that it's the same as what you have in mind when you're president. It just feels like the ongoing business of the society at that point. But in the couple of years before I was president, I think, not really attributable to any one person, but I think certainly spearheaded by Larry Lenke, there was a real thought process and decision-making about how we were performing as an international society, and sort of the recognition that we were a U.S. society with some international members, and wanting to transit to being truly an international society. There was a lot of discussion about that. There was agreement, I think, at that time that that's where we needed to go. But I feel like in my presidency, we actually did a lot of the work that made that a reality. The vice president, when I was I'm trying to think. When I was president or first past president was Ken Chung. That was our first international PL member. And that was sort of a mark. But I think that much more important to how it's become integrated wasn't just having the one leader in the PL. It was figuring out a way to have international members be really active on committees and be committee chairs and be engaged in all aspects of the society, not just to find a couple really impressive people to be in the leadership. And now it sort of seems second nature. But at that point in time, there was a lot of discussion. We're not going to be able to do it because we're not going to be able to have conference calls, and the timing's never going to work. And I think there were a lot of sort of naysayers who, even if they thought this is a good idea in theory, thought it was unrealistic. And I think one of the things we did in my presidency and the presidents around me was sort of do the hard work to make it a reality instead of a theory. And I'm really proud of how that's turned out. I think that that's something that is successful. I think a little different, but along the same lines. It was a time when we started incorporating a lot more neurosurgeons into SRS. And the pathway of that and the issues were a little bit different. But again, that was something people have been talking about for a long time that we made real strides on. So from the structure of the society, those were really important things to me.
Well, that's super important. You talked about the globalization. You talked about the addition of more neurosurgical members in our society. That diversity has come a long way in just 10 short years. It doesn't seem like that long ago, as you said, that you were president, and we've made these great strides. You'd mentioned one thing that caught my ear a little bit, and that was about continuing the work of the society based on what the previous presidential lines and boards had begun. Can you tell us a little bit about that presidential line structure, how it functions, and how you kind of pass the baton from one to the other?
Yeah, I think one of the real strengths of the society is it's not really run by a single leader. I mean, there is someone that's president, and that person obviously has added responsibility that year. But there's a structure that's been built where there's 4 people: vice president, president-elect, president, and past president, all of whom have a real voice and make a real contribution. And I think that creates continuity. I think that creates a breadth of knowledge within the leadership, because often there are people from different perspectives: international people, pediatric people, adult people, various neurosurgeons, all of whom bring a little different perspective. And I know for me, when I joined as vice president, Steve Richards was president, and was a really important mentor for me. And not just for SRS, but really more broadly than that. And so I think it creates a really strong relationship among the leaders who work together, and I think it's a real key to how well the organization works.
That's amazing. And that continuity, that historical knowledge, and that shared mission and kind of vision towards what the future should look like will continue on and on. And each president, I think, does make their mark in their year, and it is related to the work of many people. And you've been very helpful with the globalization, as you say, and diversifying the society. We're going to ask Serena Hu a little bit more in a few minutes about that diversity and about some of her accomplishments as the first female SRS president. Of course, the late Lori Carroll was the first president-elect of the Scoliosis Research Society. That's Serena, who was the president in 2023. All right. And before we get to that, Serena Hu, if you could give a little introduction about your practice, where you live, where you work, and a little bit about your proudest achievements as president, which was just last year in 2022-23.
Right. Well, thanks, Ron. Good to see you, Steve. Good to be on this podcast. So I'm, as you pointed out, just the past president. So I left the presidency September of last year. So that would have been 22-23. And I currently practice at Stanford. I did my fellowship at Rancho Los Amigos, which is both an adult and pediatric spine fellowship. So I did sort of half and half. But as time has kind of evolved, and as more pediatric orthopedic surgeons seem to have arrived at Stanford, and we have really good ones, I still do peds, but I do more adults, like a lot more adults than peds, maybe like 90% adults at this point. So let's see here. So from the standpoint of kind of things that we accomplished during my president, and I think, Steve, it sounds like you alluded to this during your interview portion, is that part of it is the presidential line. It's not just a project that one individual has. It's like you set up priorities that we all agree on and work together with. And so I think that's one of the reasons that they get accomplished. You don't accomplish it by saying, hey, I'm president now, I'm going to do this. It's more like, oh, you know, this is what the society needs. This is what people have developed along the way. And so from the standpoint of what was happening during my presidential line, actually, it sounds like some of them were similar themes to what Steve had. So Steve, you had more globalization, I think you mentioned, and some diversity. And the president before me was our first neurosurgeon president, Dr. Shaffrey. And so his presence obviously lent a lot of credibility and support for neurosurgeon being incorporated more completely and better into our society. You know, in addition to the international focus that had been a big priority when you were in the PL, Steve. I think there's always been a goal to have more diversity from the standpoint of underrepresented minorities and women. And so this was kind of part of the continuum, but obviously having Steve as president helped a lot. And we've continued to kind of build on that and develop that. Another thing that was part of the presidential line is we all were part of the pandemic. And so having to remain relevant within the context of having to deal with meetings virtually and trying to stay relevant in that context, but also trying to make sure that people still wanted to come to our meetings after the pandemic when you're used to being at home. And when you're used to being at home, it's then you start prioritizing. What are the meetings you really want to go to? What do you really, the meetings that really add value and you really learn from? And not just on video, but where you want to be in person. And I think that the growing attendance that we've seen at the past SRS and MS meetings has really shown that the SRS is really, really relevant to our members. And so it's really continued to grow and become, you know, close to, if not surpassing pre-pandemic levels. And that's not on just on SRS and IMS, but also our outreach programs. And so I think that's part of keeping your membership engaged. And the globalization is part of keeping a diverse group of people and serving the entire world of scoliosis patients, not just North America, where we started. And then the other, go ahead.
When you go through something like the pandemic, right, you have to adapt, and your whole presidential line group really worked through a lot of that. What were the things that surprised you that were, well, now we found a better way to do it. Maybe we would have done it that way all along if we had known. Were there things like that that you got out of how we adapted to the pandemic?
So I definitely think that people got more used to learning online, or at least, you know, the younger people obviously have for a lot of their lives. But I think people like, you know, our age and down to the younger people, we had to learn how to do that, you know, online. And so I think between the decreased travel time and decreased time away from your family, I think we all learned that we can do these meetings virtually. I mean, you still need to have a personal context. You can't have a lot of the most productive committees, for example, or councils or workforces. They are successful because you've already developed the collaboration that is built really on person. But once you've built up that kind of that trust, that kind of ability to work together, I think you can really capitalize on that virtually and have more meetings that, you know, you can have take less people, less time, but you can, again, bank on that camaraderie that you've already built. So I think that I don't think we can lose personal meetings, but I think we can make a lot more of them virtual once you've built that collaboration. So I think that's probably the thing that I learned the most. I do think that some of the extraneous meetings, like I was alluding to, I think fell by the wayside. You know, people are a lot more selective about where they go. But there was the Zoom fatigue, so people didn't want to sit at home all the time. You know, so you really had to be relevant for people to want to come as opposed to your meetings, as opposed to just, listening with half an ear, Zoom wise. So that's, I don't know if it was a surprise, but if you had said, hey, why don't we just do all these meetings virtually? I would have said, oh, we can't do that, but I think you can if you have a foundation,
So, Serena, with all of the meetings that our SRS has, the annual meeting is the flagship, and the meeting in September this year is in Barcelona, and Steve Glassman is actually giving the Harrington lecture. We look forward to hearing his pearls of wisdom. But beyond the annual meeting, there's also the IMAS meetings, some current concept courses, regional courses, etc. How does SRS keep relevant in the globalization of conferences, educational opportunities, etc.? What are the priorities that SRS is following right now, and where do you think the future lies with those educational opportunities?
Yeah, so I think that's really important because different regions may have different needs, and there's different kind of local expectation and demands. And so I think we're shifting a little bit from having meetings that we run to having meetings that we collaborate with other societies, for example. So we still run some of the kind of the worldwide courses, the ones that, the hands-on things, because that's something that people really like coming to. Again, that's something you can't do virtually. But some of the didactic teaching is not something that people need to come in person. So if you tag it into somebody's regional meeting or local meeting, it makes it sort of doubly worth people taking the time to come. And so you have the shared expense, you have a shared audience, and both societies or groups get to learn about each other. So that definitely seems to be a better reward or kind of value for both the people attending as well as the societies that might be collaborating together. So again, I think there's always been that we listen to the local people, but I think there's more of the not just listen, but listen and collaborate with the local people, the local society.
Thank you, Serena. Ken Chung, you're the first international president of SRS. I'd love to hear a little bit about your vision of globalization of SRS back in 2017 when you were president. Before you do so, can you give us a brief introduction about where you're working and some highlights of your presidency?
Sure, Ron. Thanks. So I am Ken Chung. I'm from Hong Kong. I was a professor at the University of Hong Kong, Department of Orthopedics and Traumatology. I currently am the hospital chief executive for the Hong Kong U Shenzhen Hospital. So I run the hospital on behalf of Hong Kong U, and it's a hospital just across the border in mainland China, in Shenzhen. It's a 2,000-bed hospital with 3,500 staff, of which 750 are doctors. So it's a fair amount of work, but I still am practicing orthopedics and spine surgery there as well. Keep my interest in, as it were. Coming back to your question on globalization, I mean, yes, it's very true, and I think I'm often quoted, as well as quoting myself, that I am the first so-called non-North American president of the SRS in her entire history. But I've also said that at my presidential address. In fact, I just feel personally that I'm just another very passionate spine deformity surgeon who is passionate about our society and what we do as a society. Although having said that, I do feel that with my presidency, I think a lot of so-called surgeons from around the world got more fired up in terms of getting more and more involved with the society. They've come to me for advice in terms of how they can progress, within the society to get into board positions, leadership positions, etc. As well as the fact that I think more and more people are interested to get involved in various activities of the SRS. One of which is, of course, the educational courses. And that was something that I tried to do more with during my presidency, with the help of course, all the other people here. I mean, Dave, Todd, and Peter all had a role in helping moving this work forward. I think one thing that we wanted to really do with education was to make sense of the whole process. We had everything, but we didn't really have it in a very systematic manner when I started my presidential line work. And so what we wanted to do was to try to make sense of it so that we covered every aspect of deformity education from the fundamental knowledge to hands-on workshop to more scientific-based meetings, and establishing, I think, what we call the, if you like, the education pyramid. In other words, we wanted basic knowledge that deformity surgeons should acquire, most of it through maybe online courses as well as their own work. But we established a curriculum with a curriculum task force that actually helped tell everybody what they should know. Then we established the so-called fundamental courses, which are the so-called current concepts courses, which were started during my time as presidency. And we had our first course in Prague very successfully. Really, again, imparting kind of basic knowledge to people who are interested in acquiring a deformity education. And then we established and we standardized our hands-on courses to centers in Europe and in Asia to allow people from those regions to join, as well as really ensuring that everybody understands that the SRS annual meeting is really a scientific meeting of the highest level, so that's where where you obtain your up-to-date scientific knowledge in with regards to deformity education. So that was kind of the whole process that was involved, and I think I'm very pleased to see that this is continuing and that what we started has really borne fruit over the years.
Yeah, that continuity is a key point, I think. And Steve and Serena talked about the presidential line and passing along the baton from one president to the next, and how the PL works together as a team. Todd Albert, you were the president after Ken Chung. If you could comment a little bit first about where you work and your practice. But if you could pick up on the educational piece of things that Ken and David Pauly had started a couple of years before you, and how you carried that forward.
Sure, thanks. It's great to be together with a bunch of friends, and it's really true. The point is really true that you work together on this presidential line and pass on and have idea flow that each other carry. And so I'm Todd Albert. I was president, I guess, in 2018 after Ken, and I work at the Hospital for Special Surgery. I still do spinal surgery. I was actually not doing a lot of spinal deformity surgery other than cervical spine deformity surgery at the time I became president, because once I became chairman down in Philadelphia, where I was before, I slowed down my deformity surgery practice, which I'd been pretty busy, and focused a lot on cervical spine. But that being said, what I tried to do was carry on what Ken did educationally and promote that program in the Education Council, which I think has been continuing very successfully, but also was super interested at the time in two things: burnout, which is important in terms of the education, which we started lectures and a pre-course symposium at the annual meeting on it, and physician wellness. And now you see how that's taken off in the world and also become important. But the other thing was leadership, which I think we as physicians are underserved in our education. And so I was very interested in leadership and kept promoting it. And it's come forward now all the way through Serena's presidency, where she and I put together this leadership task force, which has led to this LEAD program, which I think will have a big impact in the future. We're now doing our second cohort, which is well oversubscribed. So it's obviously there's a demand for it and a need. And as typical for our society, we're providing for that need as we have for education that Ken identified. This is just part of that education and mentorship.
Fantastic. And then Peter Newton, you're president after Todd Albert, and you certainly kept up the educational legacy that the previous presidents had carried forward. One of the thrusts of your presidency was related a little bit more towards research. If you can tell us a little bit about how that was one of the highlights of your presidency, and how you helped shape that moving forward.
Sure. I'm Peter Newton. I'm a pediatric orthopedic surgeon at Rady Children's Hospital in San Diego. I'm the surgeon in chief at the hospital now, as well as the division chief of orthopedics. And that time, following Todd, I must say that camaraderie of this presidential line is something that creates bonds and friendship between people that might not otherwise be connected. A pediatric orthopedic surgeon in San Diego and a cervical spine expert in New York wouldn't always be crossing paths. But I got to say that having his mentorship, I think I was the first trainee in the LEAD program. I had Todd as my mentor and continue to. It's been a pleasure to get to know all these guys in the presidential line and gals. It's been really a spectacular experience. Got to say that's one of the real benefits of having the job.
I'm just going to
interrupt.
can I interrupt, Peter, and just say it's a really nice compliment. But one of the things Peter and I did, which maybe we're not supposed to talk about, but we I won't say decentralized, but debureaucratized the presidential line, starting with Ken, where we decreased the number of meetings and made the meetings more efficient, which I must say is super, super important in terms of leadership. Sorry, Peter, I didn't mean to interrupt you, but it just made me think of it when it was like when you were speaking. I apologize for
yeah, we saw eye to eye on that stuff for sure. Well, you asked me about research, and certainly research has been an important part of my career in spine surgery, and it was certainly one of my passions with regards to the Scoliosis Research Society as well. And during that year, one of my smartest choices was to utilize Marinus de Kluver, who was the research council chair at the time, to put together a task force and really look at our research mission, redefine our research mission, try to create a mechanism to prioritize our research, create a research agenda, and really refocus some of our work around research. But again, as Todd said, in an organized way, trying to streamline what we were doing, have it be not quite so variable year to year, but again, spend some time utilizing our stakeholders to identify what should our research priorities be, and have that be a little bit more defined, solidify the mechanism by which we funded our research. And I know that Dave had very similar work in his time as well, with a serious research effort also.
Yeah, very, very cool. It must be rewarding now, 5 years later, seeing some of the fruits of your labor with the research task force, coming forward and having some of those initiatives in place and maturing over time. And certainly Scoliosis Dialogues was one of those initiatives that you had helped us create. So hopefully it feels very rewarding to you.
Yes, for sure. And also to see Marinus move into the presidential line is also pretty spectacular.
Yeah, he's done an amazing job, and I'm sure he would agree. You guys are all wonderful mentors to him. David Pauly, the group has alluded to some of the previous forms of communication in the presidential line. I think there used to be weekly telephone calls. I think they're more Zoom-based now and maybe not as frequent. Will you tell us a little bit about how during your presidency that the PL communicated, and how you think that some of the changes over time may be an improvement over that?
Sure. So pleasure to join with a bunch of really good friends on this discussion and a little fun walk down memory lane. So I'm the chief of spine surgery at the University of Minnesota, which is where I did my fellowship, and I look out at the building where Todd did his fellowship pretty much every day. And so that it's fun to see the legacy and the interconnectedness, and that one of my mentors was trained by someone who trained in Hong Kong. So it's a very interwoven relationship, and I love that. So when I started in the presidential line, Steve Glassman was the senior guy at that point, and we had phone calls every Monday night. And that really, we got really good at that time using cell phones to talk to each other and getting work done. And then when Ken came on, it's like gee, that's harder because we just can't call Ken up in the afternoon because it's the middle of the night for him. And so we had to migrate a little bit, and Ken's ability to accommodate the rest of us was really important, and what made that presidential line continue to work the way that it needed to work, because it really, none of us made a decision in a vacuum. We all had 3 or 4 wingmen to help us in our decisions, and that collective leadership knowledge really prevented us from going off the rails and really helped us get a varied perspective from adult cervical spine to pediatric to international to all of the other perspectives. And so I think that was the camaraderie. I don't think has changed. What has changed, especially after COVID, was everybody's ability to be facile with Zoom. And that has brought a new level of connectedness, in my opinion, around the world, where it used to be a lot harder. Now the hard thing is, when can you do those Zoom meetings? And it's almost always like Sunday morning in the United States or North America. And then somebody around the world is always at a tough time zone, but it seems to work out, and it works out because of the commitment of the members to the society. That's the piece that I don't think has changed. And what I would say is that there's sort of 4 key points to why the SRS works. Number one, the patient need is great, whether it's pediatric or adult, and we don't have perfect answers, so we need to figure it out. And we also need to share the knowledge. As I'm coming to the end of my clinical time, I recognize there's an expiration date on the lessons that I learned that hurt people. And I would just as soon the next generation learn that lesson vicariously and not have to learn that lesson the hard way. And that's a big part of what we want to pass on. The next piece is we want to do better treatment than I was trained to do, and that all of us have gone through a growth process. And sometimes we've grabbed onto things that were bad ideas, and sometimes we've grabbed onto things that were good ideas. And that whether it's good or bad, it's our obligation to share with others so the same mistakes aren't made. And that one of the things that I would say was really an eye-opener for me in growth process and early in my presidential time was the time I got to spend in China, and that visiting Ken and then Nanjing Drum Tower and PUMC, and the volume and the quality of the work that they are doing dwarfs a lot of the numbers any of the rest of us can put together, and that isn't being hidden anymore in China. It's being shared with the world, and we're learning from them as they may have learned from us in earlier days. And so that international sharing, I think, is extraordinary. And then finally, I think one of the things that started during my time was really a need for advocacy, and that the efforts to declare Scoliosis Awareness Month, the efforts to involve patient support groups, the efforts to get patient perspectives, all of that, those are the things that are not going to change. So the patient need, the need for education of surgeons, the need for research to do a better job, and the need to advocate for resources. And in that advocacy piece, during my time steering the ship, there were 2 things that I am proud of. We did a Delphi process with Rand Corporation talking about the optimal treatment for adult spinal deformity, because the insurance companies could say, well, you don't have any good data, what's the information? And then Keith Bridwell with his adult symptomatic lumbar scoliosis study that was initially funded by the NIH, because of the crossover problem for the randomized portion of the trial, they stopped the funding. We were able to go to our industry partners and get that funded to bring it through from year 2 to year 8 with 8-year follow-up. And so for places that have capitated healthcare systems where you're competing for resource allocation, what is the quality of the data for our interventions, whether it's the BRACE trial, whether it's MEMO study, whether it's the ASLS, we're learning that we have to generate high quality data for our patients to have access to optimal care. And I love the mission statement that's morphed a little bit over the years, but it's the optimal care for all patients with spinal deformity throughout all ages.
All right, that was a great start, guys. So Sammy's going to pause here. If anybody wants to jump in with any comments related to what David has spoken about, we can record that in a minute, or we can kind of move ahead to our thoughts about the future of spine deformity and maybe pick up where Serena and Steve had left off.
Is this you're showing video as well, right?
Yeah.
Can I just share a photo? Just whether you
so.
show it or not.
Yeah, Ken,
I just wanted to show that.
Yeah.
For my friends there.
That's
Love
great.
that.
Nice job, kid.
Chronicle. We know that
Fantastic.
Ken in 10 years is going to be elected historian of the society.
Yeah.
Perfect job. I nominate him now.
I agree.
Well, Todd, but there's a couple other things he'll be nominated for. One is for the photographer of the society.
But
And
that's
the
what I
other,
mean, right?
yeah, and the other was for the tech support at the Todd Albert home about getting the Apple TV to work when we were doing committee assignments.
Yeah. and Todd probably never got the Apple TV to work again ever since my time there, right?
No, Hanjo got it working. I had Hanjo do it the next time. I always have to have a tech support guy.
Well, it's about your team. It's not about the individual. It's about the team.
Yeah, the photo is great, Ken. It's wonderful. You guys had mentioned this is a bit of a trip down memory lane. To this day, at board meetings, we always talk about who's going to do the photograph for the board, and your name always comes up. So one more legacy. And the camaraderie
maybe next time I'll donate a camera.
Okay, excellent. And the camaraderie is shining through here quite nicely, guys. Thanks for adding that.
I make one other point to embarrass you. It's really important, and I think everybody on this Zoom would agree, when you're like the president or in leadership, like to be able to identify people or to have people show themselves who are like amazing contributors in this society, and then they move up to different positions. And Ron, when I was president, what I remember is you were like, I can't remember, I think it was social media chair or whatever. We had nothing, and you created something that had lasted, the website. You created it and you put so much effort into it. And I remember saying, I didn't really know you before. And I remember saying, that guy's amazing and he should rise in this society. But you are a living example of how this society works, and like the gems within this society rise to the top. So thank you for what you've done, this included. But it's an important point for younger people who may be watching this, that if they have a talent and contribute it to the society, they will rise up.
No, I appreciate that. Thank you. And a lot of us do see that there is that meritocracy within SRS. If you're committed to the vision and you share the same passion and you work hard and contribute, it's a pleasure to be a part of it and to rise through it. So thanks to all of you guys. All right, I think we'll do some edits there a little bit, but thanks, thanks, Todd.
Don't get modest.
Okay.
Well, but Ron, it's a compliment to you, but it's also part of the pathway forward to the younger members. And I think that's the point that we would all echo, and that, we all have different skill sets, and oftentimes they're complementary, and that Todd's leadership skills and thought processes and engaging people are spectacular. His tech skills, not so much.
You're lucky I'm on this Zoom.
Did Barb make it work for you? Or
I've gotten better at that. Yeah.
Yeah. But I mean, that's the point, right? Is that all of us can only do what we do because we build a team of people around us that enable us to provide absolute excellent care for these people. None of us can do what we do without our nurses, without our OR team, without our clinic staff, radiology staff, et cetera, et cetera. One of the things that was hardest to do in the presidential talk was how to say thank you to everybody with a limited amount of time and not leave anybody out. And so one of the tricks that I learned there was group pictures because that helped get more people over faster amounts of time, and that all of us just came to appreciate the wealth and passion of the SRS members and the SRS staff. But I don't have strong feelings about that.
All right, that's fantastic stuff, guys. Todd, if you're able to talk a little bit more about leadership development, you're instrumental in creating the LEAD program and co-leading it with Serena, where do you see SRS leadership and leadership in general moving in the future? Is there anything that you envision beyond the LEAD program looking ahead 5 or 10 years?
Well, thank you so much. And yeah, and credit to Serena for really pushing it forward and inviting me to join her to do so. Yeah, it's growing, Ron, and it's the LEAD program is growing and evolving. And we're growing it as we do with so many of our courses and programs based on the feedback from the participants and those who teach it. But what I see happening is we will continue with cohorts going forward, and we bring in outside people for when we need added intelligence and special any specialty in terms of leadership, finance, and those kind of things. But I think what will end up happening is it will develop into that core program, but also the mentorship part. Those who graduate from that program will become leaders in the SRS and develop other programs. And so it's like the tree. The branches will reach out in all different directions, hopefully, if it's successful, and will create further leadership in spine surgery and in the world, but also in our organization will improve and sprout other things. I can envision those who graduate from the program becoming mentors to younger members, bring them along, and so forth and so on. So I'm really optimistic about it. We've had incredible feedback. The staff has done a great job. Ashton, as always, has done an amazing job. And I think it's a bright future for it.
Super. Ken, from a global outside of North America perspective, anything we can learn from you and your colleagues in terms of how we can help develop more international leaders within SRS?
Well, I think the leadership program is doing a good job in that. My understanding is involving people from around the world, and my perspective is such that culturally we're very different. Whether you're from North America, Latin America, from Europe, or from Asia, and even within Asia, it's such a diverse set of countries that even within Asia, the cultural differences could be big too. So I think the reality is that leadership programs such as this one, by bringing people together, learning with each other, and really understanding our differences and similarities, and how we can work together to advance the specialty is so important. So I absolutely congratulate you guys for doing so. And I would encourage you to keep that in mind. Nowadays, especially, the world seems to be more isolated, less globalized. And I think we as academics really should be pushing for this globalization to continue.
And in general, where do you see things heading in the next 10 to 15 years in our field?
Well, I think in terms of where we're heading, I see that if a lot of things we need to think about in terms of, for instance, AI, machine learning, that kind of thing. Maybe we should get involved in our curriculum, involved in our patient care going forward. So I think surgeons need to learn about this a lot more.
Can I jump in on that, Ron?
Yes, please.
Yeah, so I think you're hearing two themes. One is people, and that I think as a society, we're doing a good job about how do we mentor and develop people. Then the next piece is content. And so the content from our annual meeting is the best of the best. In fact, the challenge is there's so much good content coming in that it's hard for the program committee to try to figure out how to fit it all in. But as Ken was talking about, I see that we're moving from the era of spinal instrumentation into the era of spine datafication, and that the understanding of the data will allow us to learn faster. I think in spine surgery, we were a little slower to start doing multi-center, multi-cohort, large number case series, as opposed to, say, cardiology or oncology, who got into that earlier on. And that, as Ken mentioned, the world may be getting less friendly, but in our discipline, I don't think we are. I think we are all looking to see who's got a better answer, and then how do I bring that to my patients? And so I think that he's absolutely right that AI and machine learning, especially if we can figure out how to share radiographs across countries, will allow us to get smarter faster than we did in the past.
All right. Well, Steve, back to you. Let's think a little bit more about the future. How do you see things shaping up in the next 10, 15 years? Do you think the future is bright for spinal deformity surgeons? Are we going to lose our jobs to the robots, or are we still going to be around live and well?
I think we're going to share our jobs with robots. No, I actually don't think, I think that the next 10 to 15 years are going to be exciting, and they're going to be real changes. I think they're much more likely to be around data than they are to be around better tools. I think that we've made tremendous strides in the last 10 years looking at static elements like alignment as guides to treatment, and especially in adult deformity. We've sort of used that as a proxy for symptoms that are, most commonly related to neurogenic, problems, claudication, stenosis, because we don't have a way to measure that effectively. But I think that there's going to be an explosion of new data sources, whether that's wearables, whether that's implants, and instead of having a little bit of data and we're imputing things from it, I think we're going to have real data streams and measured outcomes as opposed to reported outcomes. And I think that's going to give us ability to make much better decisions about who we operate on, to differentiate problems that are truly related to the deformity versus problems that are peripheral to the deformity. And I think that that's going to be a real breakthrough in outcomes, because I think it's going to improve patient selection.
And Peter, you've been very innovative over the years. You've been a key decision-making and knowledge leader in pediatric deformity. What's your vision over the next 10 or 15 years? How are we going to be treating our patients? What are some of the key points for us to be considering down the road?
Yeah. Well, I would like to think that we, through this data, I agree with the rest of the group that I've been working to collect data through the Harm Study Group for a number of years, but the mechanism by which we get that data into a system right now continues to be, highly dependent on humans, which would be nice if we could get past that in some way, to really then be able to use it in greater volume. But the idea that we all do this operation, no matter which one it is, but just pick adolescent idiopathic scoliosis differently. It's there's just one operation that we each do, but it doesn't seem to be very similar. As much as we try, getting that to be standardized in some way that creates more reliable outcomes. And it's a pretty reliable operation, but it's still not perfect. And I really do think that we'll have better ways to understand and create the deformity correction that it should be our goal, with the right levels and the right shape and the right three-dimensional correction. On the early onset scoliosis side, I think we still have a huge problem to solve. It's an area where obviously there's been a lot of innovation of late. These technologies, although maybe 10 years in the making already, are still very much in their infancy with regards to us understanding what we can accomplish with these methods. And the really young patients, we still have really no spectacular solutions. We do things, but and we do our best, but I really think there's enormous potential to improve what we do in that category. And whether that's going to be, different instrumentation, more instrumentation, or less instrumentation, and some other methods, I'm not sure, but that's still an area that, at least on the pediatric side, is very much an unsolved problem.
Yeah, a lot of gaps in the knowledge right now, lots of room for improvement. Any thoughts on any of you about some patient-specific type of modeling to help base some of our interventions and treatments?
Yeah,
Well,
again, I think on this, at least on the adolescent idiopathic scoliosis side, where we should have lots and lots of data and many outcomes, understanding the rod shape, the rod material, and to some extent, how much flexibility is required in the spine and where we should really help us to get that one perfect for every patient.
Yeah, so I completely agree with Peter on that. I think AIS will be the first one where we will come closer to getting less variability. And then on the adult side, the patient-specific modeling isn't just radiographic. It's also going to be biomics. It's going to be what is their telomere length, what is their health status, what is their bone quality, how do we optimize all those things, what are their expectations and what are our capabilities, and do those match or do they diverge? And when they diverge, then, one of the hardest things for us as surgeons is to say no, but saying no at the right time is still really important. And so all of that is just exploding and in a very exciting place where I think we're going to be able to risk stratify, not, gee, you're an adult spine deformity and 75% of those patients do well, but you have these specific sagittal and coronal parameters, you have this bone density, you have this muscle mass volume, you have this telomere length. Here are your specific risk-benefit profile analysis for what you have. And I think that is going to be the future. And whether we drive it or whoever is paying for the healthcare in whatever country drives it, I think that's the direction that we're going to end up going.
And if I could jump in and here's what you have, and here's how you could optimize yourself to be able to have a good outcome, at least on the adult world, I think we'll be able to do that.
Well, I think that's true on the pediatric world too, especially in the really early onset. I mean, halo gravity traction, look at what that's done to improve health and decrease the neurologic risk. And optimization comes in many forms. And it may be, for our spinal muscle atrophy, our muscular dystrophy kids, that optimization is gene therapy or enzyme replacement.
And maybe adding to that too is the ultimate personalized medicine, if you like, is for us to solve the issue of AIS, to really understand what it is and how many different conditions we're really talking about.
Jean Dubosset's pill to treat AIS. We're not there yet.
Yeah, it'd be lovely to be in a position in the future where we don't call it idiopathic scoliosis anymore. We know what AIS is caused by, and we have a treatment for it, or preventative medicine for it would be ideal.
Amazing.
So I like to tell my residents idiopathic means I'm an idiot and the patient has the pathology.
We need to get one corny joke in during this episode, David. And there it is.
He snuck it in. He snuck it in when we weren't looking.
Yeah. We didn't know when it was going to happen, but we knew it would happen.
An ambush. It was an ambush. David Polly, bad joke ambush.
Well, that seems like a great place to wrap things up. Thank you all for your time. Thank you all for your leadership of SRS over the last 10 years and beyond. And you've all been amazing mentors to so many of us within SRS and even outside of the society. You're all amazing clinicians. David is holding up a couple of SRS hats. We've got the old logo on his left hand and the new logo that Peter Newton helped develop in his right hand. And just one more example of how SRS has evolved with the times, and it was a great time to kind of move on with some new swag, some new logos, and we've got a bright future ahead of us. And thank you all for laying that foundation for the SRS.
Thank you. Thanks, Ron.
It's our pleasure.
Thank you.